Dr. Andrea Paolo Rosso, medical surgeon, specialist in dermatology and venereology, contract lecturer at the Department of Pharmacy at Camerino University. Dr. Massimo Ragugini, medical surgeon, specialist in vascular diagnostics, first-level medical executive.
Le problematiche corporee di tipo estetico sono varie ed assumono aspetti molteplici.
There are various problems associated with beauty treatment, and these involve numerous different aspects. The different marks of so-called cellulite, excess weight, loss of skin and muscle tone, localized fat cushions, circulation stasis and liquid retention. In all these cases, the main desire is to resculpt the shape of the body according to specific requirements or models, reducing the circumference by a few centimeters, upgrading skin tension and muscle mass, eliminating excess fat and cellulite. Very often, these requirements do not involve the body as a whole, but are focused on specific parts, above all the hips, the abdomen, the glutae and the thighs.
Tutto il corpo, ma si concentrano in parti ben localizzate, in parti circoscritte, soprattutto la zona dei fianchi, dell'addome, quella dei glutei e quella delle cosce. Il trattamento delle problematiche corporee di questo tipo deve quindi sfruttare approcci differenti e tra loro sinergici. Va quindi precisata una corretta strategia alimentare, deve essere studiata un'appropriata attività fisica e scelte anche delle metodiche mediche.
The treatment of body problems of this type must exploit different and synergic approaches. A correct eating strategy must therefore be devised, with appropriate physical exercise and targeted medical, surgical and beauty treatment intervention. Beauty treatments should envisage a broad range of choices to enable the operator to adapt his or her instruments to the complexity of the specific case. Draining methods must be used for venous and lymphatic circulation, lipolytic methods for excess fat, stimulating treatments in case of loss of muscle tone, and everything that can improve trophism, oxygenation, and the nourishment of the skin and subcutaneous area. In this study, we have tried to assess the effectiveness of a complex apparatus which associates infrared, ultrasound, and electrostimulation on a group of people with silhouette anomalies caused by cellulite, fat, and the loss of muscle and skin tone.
Anomalie della silhouette, soprattutto da cellulite, da adipe e da perdita di tono muscolo-cutaneo. Lo studio è stato effettuato su 12 soggetti volontari di sesso femminile con età compresa tra i 23 e i 41 anni.
Materials and methods. The study was performed on 12 voluntary patients, all female and aged between 23 and 41. The patients were selected on the basis of the presence of a change in correct body silhouette due to the presence in the abdominal glute thigh area of one or more of the following aesthetic situations: cellulite in any stage and with any characteristics, recent, soft, lymphodermic with adipose, etc. Excess fat, localized or extensive. Loss of skin tone and elasticity. For experimentation, the Slim Up Ultra appliance was used that can operate with infrared rays, electrostimulating current and ultrasounds. The infrared section achieves deep heating with 6 100-watt lamps with emission spectrum selected for the most penetrating wavelengths. The lamps are housed on a moving arm. The temperature of the skin surface is controlled by an electronic sensor that reduces emission intensity at the threshold of 43 degrees.
La temperatura della superficie cutanea, quindi la temperatura raggiunta dal corpo, è controllata da un sensore elettronico, il quale riduce automaticamente l'intensità di emissione alla soglia dei 43 gradi. La distanza tra braccio che tiene le lampade e lettino è standardizzata in base all'altezza del lettino.
The distance of the arm from the body is standardized according to the height of the couch, and the angle of incidence of the irradiation is such as to cover the body surface uniformly. The increase in in-depth temperature would justify the raising of the adipose tissue metabolism according to the known law of 14%, increase for each degree of temperature. Besides this, the infrared rays can increase the oxygenation, blood flow, lymphatic return, cell regeneration, and the penetration of cosmetic products. The electrostimulating section is distributed on 8 channels that can be individually adjusted in terms of intensity, and exploits a bidirectional compensated square wave current at low frequencies, 2 to 80 Hz. The 16 electrodes, adhesive and heat resistant, can be applied all over the body and stimulate the large deep muscles in order to firm and sculpt shapes.
I 16 elettrodi che sono adesivi e resistenti al calore, possono essere applicati su tutto il corpo e permettono quindi di far lavorare tutti i grandi fasci muscolari profondi al fine di rassodare e modellare le forme, di far perdere energia e quindi di contribuire al modellamento e alla riduzione. Però l'elettrostimolazione permette di lavorare anche sui sottili fasci superficiali e sottocutanei.
But also the thin surface and subcutaneous muscles, so as to also recover the loss of skin tone. A face handpiece integrates electrostimulation with a high-intensity white light featuring latest generation LEDs. The ultrasounds are emitted by 20 sources distributed on 2, 4 and 6 emitter plates. The vibrational energy emitted raises local temperature along with the previously seen action of the infrareds. In the deep tissues, rich in liquids, ultrasonic cavitation is also developed, an implosion of newly formed microbubbles, such as to promote a permeabilization of the adipose membranes with lipolytic effect and a fibrolysis on the often hypertrophic connective branches. The ultrasounds are also distributed with the single handpiece for localized areas and naviculation of active principles.
Gli ultrasuoni sono distribuiti anche con un manipolo singolo per zone localizzate e per veicolare con più precisione dei principi attivi cosmetici. In Slim Up Ultra sono residenti 7 differenti programmi di trattamento di tipo multifase, con una miscela ragionata delle differenti sorgenti di energia, tempi, frequenze, durata di imputo variabili.
Slim Up Ultra contains 7 different treatment programs of the multiphase type, with reasoned mix of the different energy sources, times, frequencies, duration of variable impulse. In this study, 2 work programs have been used. Slim, for those persons with prevalent abdomen-hip problems, and Mega Slim for prevalent glute-thigh problems. Each session ended with pressotherapy treatment using the Slim Up Drain appliance, so as to favor detoxification, liquid drainage, and the mobilization of the products of the metabolism of the adipose tissue. In order to restrict external effects to the utmost, the volunteers were asked to maintain their normal lifestyle, and in particular not to start slimming diets, beauty treatments, or beauty therapies, and cycles of sports activity or physical activity in general during the study period.
Tutti i soggetti selezionati hanno portato a termine la sperimentazione. Ogni soggetto ha effettuato 12 sedute nell'arco di tempo che va dal 6 ottobre al 1 dicembre del 2020.
All the selected individuals completed experimentation. Each individual performed 12 sessions during a period of time between the 6th of October and the 26th of November 2007. The assessment of the response to treatment was based on the following instrumental parameters: measuring of weight in kilograms and measuring of circumference in centimeters at repeatable heights. These figures were recorded at the start of each single session. Final measurement was made a week after the last session. A standardized method was used exploiting the Slim Up Station appliance. This instrument uses a self-tensor circumference measuring belt with automatic recording of measurement height off the ground, so as to make all the subsequent readings repeatable and objective. Besides weight, account was also taken of the measurements in centimeters around the waist, the tummy, the hips and the thigh.
Oltre al peso sono stati misurati il girovita, il ventre, i fianchi e la coscia in centimetri. È stata poi effettuata anche la rilevazione della composizione corporea con un bioimpedenzimetro a multifrequenza BA101 della Italia di Firenze. Questo esame è stato effettuato sia all'inizio del ciclo di trattamenti che una settimana dopo la...
Detection of body composition has been obtained with a BIA101 multi-frequency bioimpedance meter made by the company Akern of Florence, Italy, determined at the start of the treatment cycle and 1 week after its end.
5 MHz su punti di repere ripetibili alla coscia, precisamente 3 cm posteriormente alla testa del femore e al fianco. La misurazione è stata rilevata all'inizio del ciclo di trattamenti e una settimana dopo la fine.
An ultrasound scan of the soft tissue has been made using an Esaote Biomedica Firenze, Italia appliance, and 7.5 MHz probe on the repeatable thigh reference points, 3 centimeters to the rear of the head of the thigh bone, and hip reference points determined at the start of the treatment cycle and 1 week after the end of the cycle. Ultrasound scanning is currently the best way to directly evaluate the conditions of the tissues with reference to the thickness of the fat, to the quantity of deep liquid in stasis, to the density of the fibers and connective branches. 4. Photographic documentation in the 3 front projections, dorsal and left lateral, at the start and 1 week after the end of the treatment cycle, using Nikon Coolpix digital camera in mandatory flash position. To obtain the maximum reproducibility and standardization of the test, a photographic station was used consisting of a squared background with 10 by 10 centimeter meshes. Mandatory positioning of feet in depth and width by means of templates fastened to the floor, camera located at mandatory height on a tower at a predetermined distance tied to the backdrop with rigid platform. Results.
I risultati ottenuti sono stati notevoli.
The results were very interesting. Despite the absence of any dietary restriction, an average reduction of 2.2 kilograms was achieved, probably the result of the infrared and ultrasonic lipolytic effect on the fatty masses. The data relating to the measurements taken in the 4 study points must be underlined. The average reduction of the total of the 4 parameters amounts to 22.04 centimeters, with a reduction of 4.6 centimeters at the waistline, 6.9 centimeters at the tummy, 6.5 centimeters at the hips, and 4.3 centimeters at the thigh. These data are even more significant when studied case by case, because the average of the 4 points, or the average on the 12 patients, tends to level out the best results for each single individual. We have in fact found the following best reduction results. At the waistline, 8.5 centimeters, at the tummy, 10.2 centimeters, at the hips, 9.8 centimeters, at the thigh, 6.1 centimeters. These are the photos of a number of patients before and after the treatment cycle. Strong reduction of tummy and hips, increase in space between thighs, visible improvement to hips, excellent reduction of waistline and tummy, reduction of waistline and hips, reduction of waistline and more space between thighs, strong improvement of waistline, strong improvement at thigh level with increase in space between limbs, reduction of tummy and hips, major reduction in volume of glutae and thighs, lifting and reduction of glutae, reduction of tummy and waistline, reduction of tummy, less contact inside thighs, more toned up thighs and lifting of glutae, good reduction of abdominal prominence and trochanteric cushion, reduction of tummy, strong tummy reduction. Reduction of waistline. Good reduction of dorsal handles and folds, firming of glutae. Reduction of waistline. Much flatter tummy with reduction of handles. reduction of handles and sculpting of waist and hips,
Modellamento della vita e dei fianchi.
strong reduction of
C'è
tummy
una
and
forte
handles,
diminuzione della pancia e delle maniglie. Si osserva una notevole diminuzione delle
considerable
cosce,
reduction of
con aumento dello
thighs with
spazio
increase of
tra
space
le
between
e
these,
un miglior
improvement of waistline and tummy,
della pancia. C'è una riduzione consistente del giro
considerable reduction of waistline, hips, trochanteric cushions, increase of space between thighs, improvement in appearance of cellulite, excellent reduction of waistline and tummy, strong reduction of abdominal volume and hips, excellent increase in space between thighs, excellent reduction of handles and relevant dorsal folds, strong improvement of abdominal prominence both above and below the navel, reduction of the dorsal fold,
e anche una diminuzione della plica dorsale.
strong reduction of tummy, waist and thighs with increase of space between limbs, increase in space between thighs, improvement of abdominal tone and reduction of handle, considerable reduction of waistline and tummy, strong reduction of thighs with more space between them, excellent improvement of waistline and handles, better glute tone, reduction of cellulite marks and cushions, strong increase of space between thighs, reduction of tummy and waistline, reduction and firming of glute and subgluteus cushion, excellent increase of space between thighs with reduction at hips and waist, excellent reduction of handles and relevant dorsal folds, firming of glute, drop in cellulite depressions, increase in space between thighs, reduction in size of thighs, reduction of abdomen and lifting of glute.
Anche I valori impedenziometrici risultano estremamente interessanti, soprattutto per l'assenza di una concomitante
Impedance meter readings are also extremely interesting, especially considering the absence of a contemporary diet and backup physical exercise. Replacing fatty mass with muscle mass does in fact normally involve increase in movement and correct diet. The treatment was able to considerably improve mass distribution, with a 1.2 average reduction in the percentage of fatty mass and a contemporary 0.95 average increase in the percentage of muscle mass. This means fat was positively replaced by muscle tissue, even without an increase in physical activity and an appropriate diet.
Anche in assenza dell'incremento dell'attività fisica e della dieta appropriata. Il trattamento ha avuto effetti su tutti gli strati del sottocutaneo. La riduzione media misurata in sezione ecografica alle cosce è stata di
The treatment affected all the subcutaneous layers. The average reduction by ultrasound section at thighs was 0.4 centimeters. The images showed a good response of the fibrous structures, with a reduction in the thickness of the hyperechogen layers in most patients. There was also a strong improvement in the aqueous component of the deep layers. This resculpting, in the sense of a greater tissue physiology, leads us to presume there will be a good response in the future as well. Good results for thighs and excellent results for hip thickness. Excellent reduction in thickness for aqueous component in deep layers as well. Same result for abdomen. Excellent reduction on all layers with ultrasound slimming appearance of hyperechogen strips, fibrous structures. Excellent reduction of thickness of aqueous component in deep layers as well. Same result for abdomen. Modest results for thigh thickness, but good results for abdomen. Excellent reduction prevalent on more surface layers. Stationary situation. Excellent reduction in subcutaneous thickness, with significant reduction of the aqueous component in the deep layer. Good results on all the layers, with excellent ultrasound appearance results. Good results on all the layers. Modest results as regards thickness, but good results on structures. Modest results on thigh thickness. Treatment with the Slim Up Ultra appliance, performed over 12 sessions without contemporaneous diet and increase in physical exercise, showed itself to be considerably effective. The following results were achieved: excellent reduction in circumference centimeters, waist, hips, glutae, thighs, shift of fatty mass to muscle mass in accordance with a good reduction in body weight, a much improved appearance of silhouette documented by photos. The ultrasound scan of the soft tissues further confirmed rearrangement of deep tissue relating to the aqueous, adipose and fibrous component, with expectation of further improvement of the external parameters in the immediate future. To the expected lipolytic action of the ultrasounds and infrared rays has certainly been added a strong firming component due to the electrostimulation, which has affected centimeters and silhouette. Probable consequence of the considerable rearrangement of the deep tissue in a more physiological sense, indicated by the ultrasound scan.